Right. Hi, everybody. Thanks for joining us this lunchtime. My name's Chris Baggett. I'm one of the public health portfolio leads in the Birmingham Council Public Health Division, and I'm leading this project, which you're all here for today. So this is the Birmingham Culturally Intelligent Approach to Chronic Headaches and Migraines in Pakistani Communities project. It's a little bit of a long title. We abbreviate it to BCIAHP, which is also not an easy acronym to say. I'll just be referring to it as this project from now on. And joining us today are my colleagues Rupi and Ellie. Would you just like to introduce yourselves? Rupi first, then Ellie.
Hi everyone, I'm Rupinder or Rupi, and I'm a public health officer supporting Chris.
Hi everyone, I'm Ellie Jarazek and I am a programme officer in the communities team supporting on this project.
Thanks both. So if I can go on to the next slide, please. So this is a project that we've been running in the Public Health Division at Birmingham City Council for most of this year. It started right at the start of the year. It's supported by a quality improvement grant from Pfizer Limited, but it is our project. We've decided on the objectives and the purpose of the project and all of the interventions that and activities that have been occurring on the project since the start. So what we'll do today in the next 40 minutes or so, we'll talk through a little bit of the detail about this project, explaining, if you're not already aware, some of the details, and explaining the different phases of the project and how this webinar in particular fits into the project and what the opportunity is to be involved in this pilot phase. If everybody is able, everyone's on mute at the moment, but if everyone's able to keep their microphones muted, that'd be really helpful. If you do have any questions as we go along, feel free to put them in the chat or the Q&A option that should be at the top of your screen. There will be time for questions and answers at the end of the session. They'll either be picked up in the chat by Rupi or Ellie, or we'll come to them at the end of the webinar, if that's okay for everyone. Next slide, please. Thank you. So this project, as I've said, it's being led by us in the Public Health Division at the Council. We're working across Birmingham on it, but we're particularly focusing on East Birmingham in this first phase of the project, the one we're working on at the moment. And we'll be, at the end of this part of the project, we'll be reviewing how the project has worked and looking to see how we might work across the whole city going forwards. So this project is all about exploring the prevalence and the impact of chronic headaches and migraines within Birmingham's different Pakistani communities. We've done some data collection and analysis, which I'll come on to again in a moment. We've done some community-led research, and we've done participant surveys online right at the start of the project to help us understand the impact and the experiences of people experiencing chronic headaches and migraines. We're aiming to understand the barriers that people face in accessing support, diagnosis and treatment, as well as understanding the cultural perceptions and the barriers that the different communities experience around headaches and migraines and how they impact on both the people experiencing the symptoms and their families and communities. Through this project, we've co-produced some culturally informed information resources, and we have designed those for different audiences. And I will be coming on to them in more detail in the webinar. But the main source of resources we've designed are for individuals, members of the Pakistani community in the city, to help them understand and improve their awareness of headaches and migraines, what might be triggering them, how they might prevent or self-manage more effectively, and really importantly for yourselves here today, understanding what sort of information is really helpful to make a note of and to use in any consultations with community pharmacists or with GPs to hopefully improve the effectiveness when they do need to seek clinical support. We've also developed resources for healthcare providers, because at the start of this project, we collected data and we had some feedback that suggested healthcare providers would really value more resource and information to help them improve their cultural awareness and cultural sensitivity when engaging with members of the Pakistani community around this topic. So we've got the two audiences, both community members and healthcare professionals. Next slide, please, Rupi. So just a quick slide on why we're doing this project, why we've chosen this topic and this community. So there was an international study a few years ago, and that found that for people living in Pakistan, not Pakistani communities living in this country, but people living in Pakistan, 40% of respondents suffered from migraines. And there's some more details there, as you can see. The majority were female, the majority were within the younger age cohorts, many of them students, and around a third had a family history of migraine. So we know from that research study that Pakistani populations in Pakistan itself have high prevalence of migraines and chronic headache disorder. What we didn't know was what that looks like in Birmingham. That study did talk about the triggers, and we wanted to explore those in our city as well. So we know that the Pakistani population in this city makes up about 17% of the population, according to the last census, the most recent census. So if those international data are representative in this city, we would estimate that the significant impact of headaches and migraines is quite large in our city. And that's what we wanted to understand more about and understand how we might address that in a more effective way. So we wanted to understand the barriers to treatment so that we could deliver more culturally informed information and interventions to support the population, both in prevention, management, and seeking clinical support when necessary. Next slide, please, Rupi. So the project has 3 aims, and these have stood since the start of the project, and we've been delivering them in different phases of the project. So firstly, we wanted to increase the understanding of headaches and migraines within Pakistani communities, raising awareness and understanding, so that people understand a little bit more about what they might be experiencing or what their family members and friends might be experiencing, and why it's important that they understand the symptoms and what's happening to them. We wanted to increase the awareness and understanding of what actions people can take to reduce the impact and the risk from headaches and migraines, whether that be seeking a formal diagnosis, whether it be self-management. And we wanted to enhance the understanding and recognition amongst healthcare professionals about the cultural context and the experiences that our Pakistani communities have related to headaches and migraines in the city. And that's to improve clinical effectiveness and clinical treatment. So throughout the project, we've had four different phases, and I'll set the context of where this piece of work and this webinar sits in a moment. Initially, at the start of the project, we wanted to understand what the data that we have available to us could tell us, and also collect new data from the community themselves, and hear from the community to understand from their perspective what their main issues and experiences are. So in the initial phase 1 of the project, we had access to all of our data was anonymized. It was non-personal identifiable, and and we understood a little bit more about what the data tells us in the city and also what the population themselves were telling us. That led on to phase 2, where we worked with a provider who in turn worked with both healthcare professionals and members of the Pakistani community to co-design resources to address the needs that they identified as most important. Phase 3 is where we're implementing those resources, where we're putting those resources out both into the local community for community members themselves to make use of, and for healthcare professionals to make use of. And then finally, and actually throughout the project, we've been working on evaluation to understand the impact this project is having, how the project is being implemented, and how the resources are making a difference. Next slide, please. So phase 1 was where we were, as I said, we were focusing on data collection and data analysis. We had some anonymized primary care data, GP data, and which covered a 12-month period, as described on the slide. The amount of information in there was relatively limited, but it did help us understand the number of patients coded within that 12-month period for headache and migraine consultations, and the number of medications prescribed over that 12-month period as well. We also had access to anonymized hospital episode data, and that helped us understand attendances at our hospitals in the city where the primary diagnosis code related to either headaches or migraines. That was a different 12-month period. So the analysis that we did as a result of that, those data points, showed notable differences between different ethnic groups in the recording, treatment, and outcomes of headaches and migraines across the city. While the Pakistani population had prevalence of headaches, migraines, broadly in line with the city average, and prescribing rates similarly, the data did suggest that the standardized hospitalization rates were significantly higher than the city average. And that was suggesting to us that there are potentially gaps in opportunities for intervention and improving care pathways for the Pakistani community. We do have data for other ethnicities as well, but the Pakistani community particularly stood out in terms of the difference in hospitalization rates. Next slide, please, Rupi. So phase 2 was where we focused on the co-design of the resources. And over the next few slides, we'll show you what those resources look like. Some of you may have seen these over the last couple of days. So we've co-produced, or our communities have co-produced information resources in both English and Urdu. Urdu was the language that people told us they would find most useful alongside English. And the resources, the green resources, if you want to think of it like that, are the ones that should be displayed in patient-facing areas. So whether that's in a community pharmacy or in a GP surgery. On the screen on the right-hand side, you can see what our A3 posters look like. So these are our posters aimed at members of the community. They include fairly simple and straightforward infographics, which the community told us was important. Information about what might trigger or cause their headaches and migraines, what they should and shouldn't do to try and reduce the impact. And importantly, at the bottom, I appreciate it's small on the slide, but importantly, what information would be really helpful for them to make a note of to take along to any consultation with either a community pharmacist or a GP or a practice nurse, so that they have a more effective consultation. At the bottom right-hand corner of this resource, and you'll see it similarly on all of the other resources, is a QR code, as well as a website address. So the QR code and the website address will take you through to the same pages on our council website. That's where people can find out much more information about this project and copies of all of the resources if they want to use digital versions of them. Importantly, and I'll come back to this again later, there is a feedback survey available through our website where we really want to encourage people using these resources, community members, to tell us what they think of the resources so that we can make any improvements before we have further rollouts of the information that has been designed. Next slide, please. Thanks. So the other main resource for the community is the green document on the left-hand side of this slide. So this is a booklet, 20 or so pages, I think, 24 pages. And it's an A5 booklet, so it's smaller than the poster that you've just seen. And this is designed for members of the community to pick up, take home, make use of, share around their family and friends. Again, this is what you're seeing on the screen here is the English version. We do have it in Urdu, just like we have the poster in Urdu. All participating pharmacies and surgery practices will get copies in English and Urdu of both of these resources. So the posters are designed to obviously be on display where the your patients and customers will see them. These booklets are also designed to be put on display where people will be able to find them and pick them up and take them away. The blue document on the right-hand side is also a booklet. This is slightly larger at A4. This is specifically designed to support healthcare professionals with improving their cultural humility and cultural awareness of the Pakistani community. And it's designed to support those conversations that people might have with patients and service users. So the blue booklet, which you'll also get copies of, is just available in English, and it's designed for healthcare professionals only. So it's not for displaying in public areas. It's not for people to take away with them. It's for primary care GP staff or for community pharmacy staff to make use of and share around amongst the staff in case people will find it helpful. Next slide, please, Rupi. Also in the packs that you'll all be receiving is an A4 poster like you see on the left-hand side here. So this refers back to the feedback survey that I mentioned briefly earlier on. So the feedback survey is to help us understand how useful and effective members of the community find the resources and the information that we've produced. The booklets contain a lot more information than the poster. There's more writing, there's slightly fewer infographics, and there's much more detail in those booklets that members of the community should find useful according to what they've told us they would like and according to the designs that they have produced. So I should say that the content of both the posters and the booklets has been determined by members of the community themselves. They've not been designed by us. We've had them professionally produced, but we haven't significantly changed the content based on what the community told us was important to them. So the feedback survey, which is available via the QR code, this is a different QR code and a different website link at the bottom of this poster, is for people to tell us what they think of the information that we've made available. And we'd also be very grateful if you could display this poster, preferably alongside either the main poster or the booklets that you put on display, so that people understand there's an opportunity to tell us what they think. It's really important that we hear from the community to see whether they find this information useful. To encourage participation in this feedback survey, we're running a prize draw, and there we have 4 £25 high street shopping vouchers available, which will be randomly allocated to people who are eligible and complete the feedback survey for us. There is a cut-off date, there's terms and conditions, it's all on our website. People will be able to find that if they use the link, use the website, sorry, or use the QR code. I saw a question pop up. Let me just check that, bear with me. So I'll come to that. I think Ellie might answer that question before I come to it at the end, Sima. But yeah, that's a good point, and I will come to that. So phase 3, which is the phase we're in now, and which is what this webinar is all about today, is where we're putting the resources out into the community, testing their effectiveness and their value to members of the community and also to healthcare professionals. And hopefully you were aware of that, and that's why you've registered to join us in this phase and to join us on the webinar today. So we're inviting up to 10 practices, GP practices, and 10 community pharmacies, mainly in East Birmingham, to take part in this pilot implementation phase, to test the co-produced resources that we've shown you. So I should say that the resources we've shown you are the physical resources. There is also a video resource which addresses some of Simon's points in the chat, but I'll cover that if Ellie doesn't in the chat later. We're particularly interested in gaining the perspective of clinicians and to help us understand how useful and informative these resources are to your patients and your service users. And we really value your involvement and the feedback that you're able to support us with on this phase of the project, because without your support and involvement, the project is unlikely to be as effective as it could be. And we appreciate that lots of our community members that we're trying to improve the awareness and understanding of will be either coming into local community pharmacies or into practices to seek advice or support. So the webinar today is part of this phase 3 part of the project. And hopefully you're already aware, but just in case you're not, any participating practices and pharmacies will be reimbursed for your time here today at this webinar and for completion of the 2 evaluation activities. So there's a pre-implementation survey and a post-implementation survey. Both need to be completed as well as this webinar for that £200 reimbursement per participating location. Thank you to those who've already completed the pre-implementation surveys. You would have received those as part of the notification of this webinar. If anyone has registered and joined this webinar without seeing those pre-implementation surveys, I think we'll be sharing the link in the chat and we will make sure that it's resent out to you after the session. I would encourage you, please, if you could complete the pre-implementation survey if you haven't, before using the resources. So whether that's putting the posters up, the booklets out for the community members, or indeed looking through the healthcare professional booklet. It's really important that we have a bit of baseline data to understand your perspectives before the full implementation of the resources. Just a reminder as well, we really need that pre and post implementation surveys to be completed by people who are involved in patient consultations around headache and migraine symptoms. So it's really helpful to have the perspective of practice managers or reception staff, but for the appropriate data collection, we really want and need those surveys, both pre and post to be completed by staff who are providing clinical consultation, advice and support. So if that applies to your pharmacy or your practice, please do ensure that one of your clinicians is also able to complete both the pre and post surveys, please. Payments will be processed through the usual Birmingham City Council invoicing procedure, where you send us an invoice and we will supply you before that stage with a purchase order number that you can quote on that invoice, and then payment will be processed as you might be processed for any stop smoking or health check activity. So just to summarise the opportunity and the actions that we're focusing on as part of this phase of the project. So you're all here attending this introductory session. And again, if you need to share this or brief any of your clinicians on this, if you're not a clinician yourself, please do share. We'll share the slides after the session, and we'll also be making the recording available as soon as we can. Please do brief any of your clinicians on what we've discussed today and with the information that you're aware of. You will all get packs of this information. So all those who had signed up by Monday afternoon should have received a pack during Tuesday. If you haven't, please let us know. We will be posting any further resource packs out over the next few days, hopefully early next week. Otherwise, you will already have received them. So we'd like you, as I've said, to display the green materials. So that's the posters in English and Urdu, and the booklets, the information booklets in English and Urdu, as well as the black and white feedback poster in your patient-facing areas so that people can see and make use of them. And we'd also like you to engage with the blue healthcare professional booklet resource as well. So whether that's just a single clinician taking a look through it and sharing any useful learning from it, or whether it's just them using it by themselves, that's fine. But we would encourage at least one clinician in each pharmacy or surgery to take a look through that, please. And it would be great if you could share anything that you find particularly useful to support those more culturally aware consultations that you or your colleagues might be part of. And we'd also really, as I've said, welcome, and for the reimbursement, we need clinicians, people providing that patient-facing consultation, those consultation sessions to complete the pre and post implementation questionnaires. Again, we'll make sure you have all of the links and the information to do that. So that is all I was planning to run through. We now have 15 minutes or so for any questions and answers. So if people do have anything, please either take yourself off mute, feel free to turn your cameras on, or put your hands up and I can take any questions. While I'm waiting to see if anyone has any, I'll just double check Simon's question from earlier on. So you asked about providing video-based resources. And as Ali, thanks for picking up that question. So there are videos that we have produced, or that we have produced following the co-production work that was done by members of the community themselves. So we have a video in English with BSL, British Sign Language, and we have a video in Urdu also with BSL, because the community told us that those two options would be really helpful. They are already available on our social media channels, and if you go to our project website, you will find links, and we can also make sure that they are included in this slide set when they come out. So I hope, Simon, that answers your question. Is that okay? But did you have any other questions about that? No? Okay. Oh, Simon, did you want to come off mute, Simon, and just ask the question about the variation by postcodes? Oh, hang on. I'm just wondering, Simon, if you're automatically muted. You should be able to take yourself off mute, Simon, I think.
Chris,
Hi,
there
Chris.
is.
Sorry, I've got the clean in the background. That's the reason why I'm not.
No worries.
Yeah.
So you'd asked about, does the data on headaches and migraines vary by postcode across Birmingham? It's hard to say because we don't have patient postcode data. We know what the data looks like at an anonymized level by GP practice, which does suggest that there is likely to be possibly some geographic variation, but we don't know whether it's based on geography or based on different demographic characteristics of the populations in those areas. We do know hospitalization rates and prescribing rates do vary considerably between different practices. And we are able to, we do have some graphs that show which practices have significantly higher or lower prescribing and hospitalization rates compared to the general trend. I hope that answers your question.
It does, thank you.
No problem. We do know that approximately half of the city's Pakistani population live in East Birmingham, which is why this project is mainly being piloted in the East Birmingham locality at the moment, because that's where we know we've got a significant proportion of the city's Pakistani population. Hina, you've got a question. Is there a specific outcome you're looking at, such as trying to reduce GP appointments or hospital referrals and medication use, or just trying to improve the patient journey with regards to headaches and migraines? Thanks, Hina, that's a good question. So, unfortunately, this project does have an end date, and it doesn't allow us long enough to assess impacts on GP appointment activity or prescribing activity. We're hoping that we might be able to find a way to look at that in the future at the end of this project, but at the moment we're limited to understanding the sort of the behavioural intentions and the understanding that changes or doesn't change amongst the community who use the resources, which is why the feedback survey is so important, because that's helping us to understand how people's awareness and understanding improves and whether they might do anything differently as a result of it, whether it's self-managing more effectively, whether it's being more informed and more confident about going to a consultation and getting the treatment they need. And obviously, it's the booklet. Sorry, I didn't add this earlier, but in the booklets, there is a page for sort of red flag symptoms where people really should be considering seeking professional medical advice and guidance, because we understand that not all headaches and migraines can be self-managed and can be indicators of other conditions. There's also a page of green flags or symptoms which are less cause for concern. Both of those pieces of information have been guided, the content of them and the way they're explained have been guided by consultant neurologist who we've worked with from the neurology department at UHB Trust. So what we're looking at, coming back to your question, Hina, is looking at improving the patient journey. So whether that is self-managing and improving management of their own symptoms, or possibly preventing some of the headaches and migraines occurring in the first place, but also ensuring that people get more benefit and effectiveness when they do seek medical support. Like I say, if we are able to revisit some of this data in the future to see what the impact is on GP appointments, hospital referrals and medication, etc., then that would be great. But at the moment, it's slightly out of scope of this part of the project. Hope that answers your question, Hina. Are there any other questions at all? No? Okay. Thank you. If any other questions do occur to you, our email address is on the screen and Ellie has just helpfully shared it in the chat. Thanks, Ellie. Drop us an email. Take a look at our website if you want to. Again, all of the details are there and the resources. You will have, or you already have, the resource packs. We'd be really grateful if feel free to display them, display the public ones, share the healthcare professional ones as soon as possible once you've completed the pre-implementation surveys or one of your clinicians has done so. And then we'll be in touch again so that you can complete the post-implementation survey at the end of the implementation phase so that we can collect that data in for the evaluation. Any questions, please drop us an email or take a look at our website. And I hope you find the resources informative and helpful. Please let us know whether that's the case or whether you have any suggestions for how they might be improved or altered in any way. Thank you very much for your time today. Enjoy the rest of your day, and I hope the resources are helpful for you in your pharmacies and practices. Thanks a lot. Bye.